Hey guys, it's Dr. Rob with your 2-minute tip. Starting to get a little bit colder out there. People are coming in shivering with tight muscles because they've been shivering and all that kind of stuff. So it actually brings up one of the more popular questions we get, which is, do I use ice or heat on the injury? And so it actually, funny story, I had a buddy who actually had a vasectomy a couple weeks ago. And so the doctor's orders were to put a bag of peas on it, keeping it classy, right? So this is a very good example of a time that you do want to actually use ice because you're going to prevent the swelling, all that sort of stuff. So when there's acute pain, a sudden pain, and there's swelling in there that you want to control, ice is the way to go. When you're using ice, you only really want to put it on for about 10 minutes at a time. So there's a 10-10-10 rule that we use, so 10 minutes on, 10 minutes off, 10 minutes on. It'll change the blood flow pretty significantly. The biggest thing is most people's injuries though, or pain, is not a sudden acute thing. You've had it for a week, 2 weeks, a month. It's more of a dull, achy thing, right? So most of the time, that's where you're really looking to use heat. So think of your muscles and the tissue like plastic or like pizza dough. If you warm that up and get it to expand, it's gonna be easier to stretch, easier to move. It's gonna increase the blood flow. It's gonna feel a heck of a lot better with heat on it 9 times out of 10. One of the research actually points to if you put heat on something and then do a stretch, you're actually gonna get more range of motion and decrease the pain a lot quicker. So a lot of the time I go put some heat on it, then do your prescribed stretches that the therapist is prescribing you, and you're gonna get way more bang for your buck, better results with that heat on it beforehand. Okay, so if you're still not sure, if you're going, is this a cold thing or is it a heat thing? Let us know. We can make a very specific routine specifically for you and your injury, or even to keep it moving in between, so that you feel better all the time. You're doing the right thing, and you're gonna get the results for the time. So you're not wasting time, energy, all that kind of stuff. Okay, so reach out if you have questions. Ask your therapist at the next visit. You go, how do I, when do I throw ice or heat, and then what does that look like for me? Okay, have a great week.